everyone, this is Dr. Ananya. Welcome to my channel. In today's video, I'll be talking about HbA1C test. Before beginning this video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us know what is this test. HbA1C test measures the amount of blood sugar that is attached to hemoglobin. Hemoglobin is a part of your red blood cell that carries oxygen from lungs to the other parts of the body. An HbA1C test shows the average amount of glucose that is attached to hemoglobin over the past 3 months. Do you know why did I say average of 3 months? If you know, you can tell me in the comment section below. If not, here's the answer. I said 3 months because typically that is how long a red blood cell lives. If your HbA1C levels are high, it may be a sign of diabetes. And diabetes is a chronic condition that can cause kidney problem, heart disease, and nerve damage. Now let us see why you may require this test. You may require this test to check for diabetes or pre-diabetes. Pre-diabetes means your sugar levels are higher than the normal levels and are at risk of getting diabetes. If you already have diabetes, this test will help you to monitor the glucose levels. Now let us see why you may require this test. You can take this test if you are of age more than 45. So this test is used to screen for diabetes and pre-diabetes. If your results are normal, you can repeat this test every 3 years. If your test results show that you are pre-diabetic, you can repeat this test every 1 to 2 years. But if you are under 45 and you have certain risk factors, then you can also take this test. These risk factors include being obese, having high blood pressure, having a family history of diabetes, history of heart disease, and physical inactivity. You can also take this test if you develop symptoms of diabetes. These symptoms can include increased thirst, frequent urination, blurred vision, and fatigue. Now let us see how is this test done. For this test, a small sample of blood is withdrawn from the vein of your arm. The sample is then collected and sent to the lab. The results usually take a day or two, depending on the lab. So, do you need any preparations for this test? There are no preparations needed for this test, and it can be done as per patient convenience. You can either take this test at a hospital or a clinic or a lab, or you can give out the sample at home. Now, let us talk about the risk. Are there any risks or side effects to this test? There are almost no risks or side effects to this test. But make sure while taking the blood test, the syringe is well sterilized and the area is well cleaned. Now let us talk about the results. What may the results mean? HbA1C results are usually given in percentages. Value below 5.7% is considered normal. Value between 5.7 to 6.4% is considered pre-diabetic. And if your value is more than 6.5, it is considered diabetic. If you have diabetes or you are diagnosed with diabetes, make sure to keep your levels below 7%. Also, this test, HbA1C, is not used for gestational diabetes. If you have anemia or any other blood disorder, then this test might be not that accurate to diagnose diabetes. So make sure you inform your doctor about all the medications that you are taking, including the OTCs and vitamin supplements. Your doctor might require additional tests to confirm the diagnosis. Your final diagnosis is based on your test reports, your medical history, and your symptoms. If the diagnosis is confirmed, your doctor might talk with you to develop a treatment plan that works best for you. So, it's important for you to talk to your doctor before interpreting any report by yourself. And it's equally important for you to get tested from a reputed and reliable lab. A link to a reputed and reliable lab will be provided in the description below. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.